Welcome to the Real Recovery Podcast. This is episode 100, and we're marking this milestone the way we always have, by sharing real stories of recovery. In this episode, we sit down with Bill M., who brings an honest and grounded perspective on what long-term recovery truly requires. We talk about accountability, humility, rebuilding trust, and staying emotionally present, even when it's uncomfortable. Bill shares lived experience around relapse, self-reflection, and the role of community and service. Episode 100 is a reminder that recovery is built one honest day at a time.
Hello, and welcome to the Real Recovery Podcast. I'm Julie, your co-host. On this journey of healing and transformation, together with my co-host Peter, we dive into the heart of recovery, sharing stories that resonate with courage and inspiration.
That's right, Julie. Each episode is a new chapter in this vast narrative of recovery, and we're honored to bring them to you. But keep in mind, the perspectives you'll hear are for informational purposes only and may not reflect the views of the podcast or our partners.
Indeed, while these conversations can be a powerful part of your recovery toolkit, they are not substitute for professional medical advice. We encourage you to seek guidance from your healthcare provider for any treatment-related decisions.
And if you're facing an immediate crisis, or if you just need to talk to someone who understands, don't hesitate to call the Recovery Crisis Line at 503-223-8569. That number is also on our website. Help is available 24/7.
Now let's begin our episode
Of recovery, real recovery.
Hi, welcome to the Real Recovery Podcast. This is Julie.
And this is Peter.
And we're with Bill today, all the way from Georgia. It's so exciting. He flew in just for our show.
Yeah.
Maybe not, but it sounds good. Hi, Bill.
Hey, good afternoon.
Don't be nervous. I promise just a few minutes in and you'll feel comfortable. I promise. And there is no video, so we're good.
Exactly.
Yeah, thank God. Okay.
Yeah, because I don't dress up.
Neither do I. And now I feel funny when I host the meeting in person at the church because the cameras are there and I'm like, podcast is better. No cameras.
Yeah.
So I'm glad you're here. I'm glad we made time to do that. Peter, thank you for clearing this day in your holiday schedule.
Yeah.
Happy
to.
We were actually on blackout. Something we haven't done. No, we did it for the holidays and for New Year's with jobs and stuff. We've tried.
This past year has just been a year. So it was like, I'm going to take off some time. I need some time back.
Peter just making it through cancer.
Yeah.
And me with a new job. It has been, and we still haven't missed a podcast. So it's been like, whoa. So I'm really excited you're here today. I know you came to visit your brother. We'll say you flew in for the podcast.
I get to see all my Portland and Beaverton friends while I'm here. So it's been great to see everyone.
I love it. I really do. It's really informal. You can fucking swear if you want to. I always like to say that. There's no wrong or right. We just want the listeners to hear your story. And hopefully from that, they get some hope.
Yeah.
And if they're in recovery, which a lot of them are that listen to our story. I know that Jen every week has a review from me. It's so funny. And yeah, it's good. And that if they're not in recovery, right, they hear something that maybe makes them want to get there. Portland has some opportunities. I guess I only know your story, the 10-minute version, from when you chaired the last time you were in, you chaired for me. But the good thing is it doesn't have to be 10 minutes. There's no timer. So where do you want to start?
It took me a long time to get to the room, and I spent a lifetime of alcohol use to the very negative level of alcohol consumption. I never wanted to say I was an alcoholic. I didn't want that label. So I think for a long time, until 6 years ago, when I had a DUI and spent the night in jail and thought, maybe I've got a problem. That was the DUI was the moment for me of thinking, this is having consequences that are not good. So how did I end up not getting a DUI all the 35 years that I was actively alcoholic? I just never had the consequences. I never went across the line. One of my good friends years ago, who had been 20 years in sobriety, I would ask her, do you think I'm an alcoholic? And she'd say, I know you get your toe right to the line. And she said, if you ever cross the line, I hope you can find your way back. And I think the night in jail was definitely not just my toe across the line, but I threw my whole body across the line.
Right.
And so at that point, I thought, I need to get a program. I need to get serious about this. And with people like myself, it took me a long time to get to the room. And then I wanted to do some more research. So I spent a year sober, a year of continuous sobriety.
How was that?
It was not great because I went to AA, but I never visited with people before the meeting and I never stayed after.
Yeah.
And I never got a sponsor. I just went to AA, and
Is that because you were supposed to?
it was, yes. So it was not court ordered, but my attorney said, I think this is going to look a lot better if we go to court and you've checked some boxes. So it started that way. So I went a year in the program, and then I started dating somebody, and I thought, he wants to drink and I need to figure out new rules. So after a year of continuous sobriety and abstinence, the dating thing took me back out. But the new rule was, as long as you don't drive, you can drink. That was my new rule.
We have a lot of rules, don't we?
Yeah, I made that
Look,
rule.
after 5 weekends only. Look, yeah, no.
And that did not work well for me. I was taking Ubers or making sure somebody else would drive me. So I just didn't want to end up in jail for a DUI again. But it took me another 2 years to find my way back to the rooms. And the year that I went into continuous sobriety, which this is my 3rd year and 4 months of continuous sobriety now.
Congratulations.
Thank you. That year was really this tremendously bad year. I broke up with my partner. I sat with my sister until she died in the hospital. My brother had a car accident and he was hospitalized. And that was just like this year of everything turning upside down in my life.
And this is the sister that had the same surgery as you?
Yeah. So she and I were so close. It just took me out. And then I decided the first meeting I went to, part of it was I'm from a rural area in Georgia, and I didn't have meetings that I felt focused on a higher power. They were God-centered and the God of their understanding. If you like,
I had an issue as well.
Yeah, it was not the God of my understanding. I definitely have a higher power and I have God in my life. But when I would go to the local meetings, it was just so much like
religion,
our way. This is how God is. This is how AA works. And a friend of mine,
that turns off a lot of people and it scares a lot of newcomers.
Yeah.
And I don't have a problem with the God thing, though. I didn't trust him. When I first came in, I was like, how could he let all this shit happen to me? But I've been, because of Peter, I believe now, and I've devoured page 25 because of 4D's name, that it's not a God thing. It's a spiritual connection. It's a better way of thinking. Whether that's God or not, I think we develop a conscience of, a lot of it is like DBT thinking as well. I've noticed, because I've been doing this spiritual class at work. We have these little things you can do, healthy things. And I've been reading them, and spirituality is so different than God. Like, I don't even think I understood it until literally this year, like really getting it more. It's a connection and it's a brain thing, not necessarily a, yeah.
Yeah, that's how it is for me. I feel connected with nature. Nature's my higher power, if you will. That's my connection. That's where I go. That's why I have a oasis in my backyard, because
That's
where
what
I
they say.
feel the most connected.
They say
And
that making a connection with the sunshine and just the awe,
yeah,
the nature, like wind in your face, just being aware of other things, not just being wrapped up, which I will tell you, I can do.
Yeah.
Yeah. So I can understand where the God thing is hard.
Yeah, and it wasn't that I had religious trauma. I hear people share a lot in meetings. I just felt my alcoholic behaviors weren't necessarily related to my faith.
There you go.
And I thought, I don't really need to deal with that. And so finally, somebody encouraged me to go to extended family.
I love
And
that.
it was as COVID was starting, and I was in Georgia, and I didn't affiliate well with these very religious recovery meetings. So I went to the extended family, and the minute I went online the first time, I thought, I have found my home. I have found my tribe. I have found my people.
that's how I was when I first went in the rooms. It's, I'm here now. It's awesome.
Yeah, that's how
My
extended
people.
family was. And Lunch Bunch, I pop into Lunch Bunch when I can. Of course, the 3-hour difference, what really worked for me, and this is what worked for me getting sober, was the meeting starts at 9 p.m. on the East Coast. And every day when I was in that first month, I think if I can not drink till 9 tonight and go to extended family, I can go to bed after
The meeting.
after the meeting.
And your brain probably felt a lot better after the meeting.
It did.
Where you didn't need it. Because Peter knows I go to a meeting just to calm my brain down. It's like when my brain is crazy, I can just go to a meeting. And by the time the meeting's over, it's
calm. It's calm.
I don't even understand it because it wasn't like that for me in the beginning, meaning I didn't need to calm my brain. But now, like, I think as work got bigger and more important, my brain grew more occupied. I don't know how to explain it, but yeah,
Yeah.
definitely.
The other thing, the first month, I had enough past experience with people in recovery that I could see what worked for them. And again, my friend that said, once you cross the line, I hope you find your way back. She worked with a sponsor, and within the first 10 days of going to extended family, they would say, if anybody's available to sponsor, please put your name in the chat box. And somebody put their name in the chat box. And I took a screenshot of it, and it's my current sponsor. And he's been my sponsor ever since that day. I texted
What
him
a
that
God
night.
shot that
It
is.
was a miracle. I texted him and I said, thanks for putting your name in the, I thought there was an interview. I thought there was a questionnaire. I thought there would be a whole thing. He says, I'm your sponsor. Call me tomorrow. And I called him, and then he said, we talked the next day, and then he said, call me tomorrow. So I called him every day. And then that Saturday, he said, let's start working step 1. And so I worked the 12 steps with him all through the first 12 months of my first year of sobriety.
Did you feel
amazing.
better
Oh my
that
gosh.
the meeting was not in your hometown?
I did. For me, it really worked because
For me too.
it was not the anonymity of it. It just was, it worked well because, one, it was bedtime when I went to the meeting, and then I went to bed. But also that it was, everybody's available, like even late at night, because you're all 3 hours difference here. So I can text people. The challenge is in the morning, which is I don't want to wake somebody up at 3 a.m. because I get up at 6.
Oh, yikes.
Yeah. But
Definitely not Peter.
Yeah, that's the
Let
middle
me
of the
just
night
say,
for me.
look, you might get Julie, but you're definitely not getting Peter. He's a nighter.
But It didn't. And I'm here for a couple months a year in person. So there's a lot of friends with respect to anonymity, but I get together with all my friends that I can get together with when I'm in Portland. And I don't feel like, I think it just transcends space. That for me, it really worked well to be at a distance from my meeting because I never feel like the people are farther than my phone away from me.
Yeah.
So it's been really, it has really worked well.
That's cool. Thank goodness for online meetings, right? We have
I will tell
different
you,
sides to that.
I didn't
come
go
up,
to
but
extended family almost until you did, Bill. I was struggling with the work thing and I couldn't go to the lunch bunch because of work. And I always tell my sponsor, because he doesn't do online meetings, oh no, this person's from my nighttime meeting. I say this to Peter too. But there is a group. It's a different group. And sometimes it's a professional group. You know what I'm saying? That just can't make it to the meeting. And then you sprinkle in some of the newcomers.
Yeah.
It's amazing.
I think it's cool that everybody, what we've seen in all the episodes we've done is everybody has a slightly different way of approaching recovery. And that's cool. That's good. I prefer to go in person because I get something from that in-person contact. And that's not just with meetings, that's with I hate the phone, but then there's some people who it works the opposite, and that's cool. Everybody can have their own way. I love it.
And for me, both work. Getting to that one meeting a week in person is really good. But I will tell you, and this is my character defect, okay? I get overwhelmed sometimes when everybody wants to hug, and I don't want you to touch me. And especially if I don't know you, and so in the nighttime meeting, like especially when I'm Zoom hosting, and I did that a lot when I was off work, and I could say, glad to have you here, Bill. It was like giving each person a hug, but typing it through the chat.
Yeah.
And I got to meet some good newcomers that way and talk them into Zoom hosting. Like I talked to Andrea into Zoom hosting. I talked to Em into Zoom hosting. And yeah, I'm so much more open with the newcomer on Zoom than in person. And I know that sounds horrible.
No, I don't think it does. It's just we're all different. We all can be different.
It's a safe distance for me. Yeah. That makes sense. A safe distance.
I do go to in-person meetings on occasion. They just feel intense to me. I'm in my own home for one thing when I'm online. When I'm on the Zoom, I'm in my comfortable chair. I have my control of my coffee. I have whatever I want.
No, with my dog, like Duke is right behind me on the chair. You see him. No, and I think it is a matter of being comfortable. Peter tells this story often, but Peter was in recovery for quite a while, not feeling as comfortable.
Yeah, the meeting that I've got sober at. Yeah, it was more conservative, for lack of a better word. Yeah. And so I never felt I could be my true self. And until I met Don actually at that meeting, and he talked about the lunch bunch, we decided, let's go. And like I just said, when I walked in the rooms, I was like, I'm home. This is my home. This is my home. I love it. Yeah. I arrived finally.
And this is total tangential, but I had been in Al-Anon for many years. This would be 10 years of continuous Al-Anon participation.
Wow.
And Al-Anon has all these other rules like anonymity. You can't even tell who's your sponsor. Don't share who your sponsor is. Don't use first names. Don't call out your qualifier. That's the person that you're alcoholic, that is your partner usually, or child, or somebody who's affiliated with you. So they're like, don't name your qualifier. So when I came into AA for the first time, it was after many years of going to Al-Anon. So I was certainly familiar with the 12-step program, but my Al-Anon group was all women. And I would always use the rules like my qualifier, which was my ex-partner, and my ex-partner before that, and my ex-partner before that. So I always said my picker was broken because I could definitely pick an alcoholic as my partner. And then I realized, oh, I actually get to be an alcoholic too. That maybe that's been part of the issue all
I think
along.
we pick who we're comfortable with, and they're comfortable with what we like to do. Whether that's, I don't know, I think back in the day, smoking weed, you know what I'm saying, and whatnot. And I don't have a picker now, but did you feel comfortable with women?
I did in that group. I definitely felt I got a sponsor, and I still have that same sponsor in Al-Anon as well. And I was out to her that I'm gay and that it was my partner who was my qualifier. But in the meeting, it was comfortable because you would just say that my alcoholic. So it was never an issue. And I think most of the women, I was the only man that was in that room, and that was in person. But the day that I realized that I was alcoholic was pretty upsetting. I'm going to just say, I thought, oh shit, I'm an alcoholic. And I got through, as I said, I went out and did additional research. Then I came back, and then I made it to the next year of continuous sobriety. And I told my sponsor, I thought, this is my most vulnerable time because I made it another full year. And he said, let's start working the traditions. So then we started going through tradition 1, tradition 2. And for me, the big difference has really been being sponsored, that my sponsor, knows all of my stuff. And I was rigorous about it. Like I said, I've done this damage, I've done this. One of the hardest things was, and I've shared this at a meeting before, but I had a habit of being so drunk at weddings because it was unlimited and free alcohol. And I just would definitely black out drunk at weddings. And there was a woman's wedding that was a good friend of mine that I owed an amends to. And she had unfriended me on the only place where I knew how to track her down was Facebook. And my sponsor said, you have to find her, you have to reach out to her, and you have to make an amends to her. And I thought, how am I going to do that? And I did track her down, and she texted her and said, I just want to apologize for my behavior at your wedding. Could we talk? And she got back to me and said, absolutely. And she said, I honestly wasn't even aware of that. And I said, you didn't know about all of my drunken, inappropriate behavior at your wedding? And she goes, you know what? There's a lot of gay men in my circle, and they all gossip a lot. So they probably made what you did bigger than you even think. But you just need to get away from it and let it go. And it was great because I made the amends, but I also became aware that things that, from my perspective, the way I see it, isn't necessarily how everybody else sees it.
Lord, I am so guilty of that. Our magnifying glass, like, I can do that as well. I'm sure we all can.
I have the opposite, where like for a lot of my times, I was just having fun. Peter's the life of the party, when the reality was much different and not so nice and not so good. And I didn't realize it. See, back in my day, we didn't have phones with cameras and all of that. There was a few times when there was a video camera, and then I looked at the footage afterwards and went, oh my God, that was me. Like I couldn't believe that I was acting the way I was. And then I like to go camping a lot. And when I got sober, still like to go camping, would go with our friends, and they have varying friends that would come along. And there was this one guy, and I said, geez, I was getting upset because he was really getting drunk and almost stepping in the fire and all. And Justin turns to me and goes, that was you.
Yeah.
And I was like, what? And he goes, that was you back in the day. And that just like really whacked me in the face.
And
It's
for
like,
Justin to say it, Justin is a saint in my book. But yeah. Yeah. Wow.
yeah, I had no idea.
No, I don't think
My
we
view of
do.
myself was I was the norm of cheers. I'd walk in and, hey, Peter.
Everybody's having a great time.
And it was like that to a certain point, but the toe of the line, I went over that line a lot. Yeah, unfortunately.
But I did that. Literally the steps and all of the work my sponsor did, and I did the work with my sponsor, but all the work I did, I can be proud of that. But I always look at
Absolutely.
my sponsor and think, wow, like how amazing that he was willing. Every Saturday was when we met, and it was by Zoom that we met to do my step work. And he was just so rigorous with me with how his sponsor had taken him through the steps. And so now I know my sponsor, my grand sponsor, and my great grand sponsor. I know all three generations
I
of
love
them.
that.
Wow, that's awesome.
And I think that you didn't ask me this question, but when I got serious enough to want to get better and stop the roller coaster of my alcoholism, I went to the meeting, I found the extended family, I found a sponsor, and then I literally worked the steps. And recently I've seen my sponsor 3 times every week for the last 3 weeks. And
How
I said, I
nice.
think I probably should start over with the steps again. And he said, we need to finish the traditions, but part of what you're not doing is you're not sponsoring people. And that's one of the things that I'm doing more actively is putting my name in the chat box at the end of meetings to say I'm available to
seen you.
sponsor, because I realize one of the things that you don't do as much when you're on Zoom is have that personal connection. And so I think that's going to be the next iteration of my recovery, is to work with somebody and give back to somebody else what I was so freely given from my sponsor. And that's just the next thing for me.
Yeah.
And I don't
I
think about,
hope the podcast is a way of sharing and giving back, because I find for me, and it's crazy because I've had a sponsor the whole time I've been in AA. The first one, 23 years. He died at 99. He got sober at 76. And he had 23 years, which is insane. And he said the best 23 years of his life. He met his son at 77. But then I got my current sponsor, and I've never been without a sponsor except for from January to May of the year he died. But I find sponsoring, again, it goes back to my brain. Then I'm stressing over this person and I'm worrying about them, and it takes up so much space in my brain that I hope, and maybe this is a cop-out, but I hope like getting together for such and such or doing such and such, or going to see Al and stuff like that.
Yeah.
I hope that is a give back in itself.
Again, there's no right or wrong.
That's what I was telling my daughter.
Throughout.
She works 6 days a week, and currently she's taking back the cans for another chance. And she takes them back every week. And I'm like, that's service. She buys the snacks for Colette's Tuesday night meeting when she goes. And I'm like, that's service. Because I don't have time to sponsor right now. And I said,
Yeah.
I understand. But there are a lot of things you do that are of service.
I'm curious because for me, the fellowship before and after the meetings has become such an important part of it. It's helped me incorporate recovery into more aspects of my life. And I said before, I'm at a place now where recovery is my life. There isn't no thought of not being in recovery. Everybody I surround myself with, how I live, the principles I live by. So being on Zoom, do you miss that, having that fellowship, or do you get it from your other meetings that you go to in person? Or is it just this? I know there's a parking lot, as Julie calls it.
Fucking parking lot is bomb.
Like, there's a lot of good information in the parking lot.
There's a lot of bullshit in the parking lot that I like, but yeah.
So to answer your question, I'm a university professor and I do addiction recovery research. So I work with specifically hospital organizations in this entire state of Georgia.
Wow.
On addiction recovery research. And so any given week, I might be in a hospital on the other side of the state working with a clinical team that works with patients and works with linking people to recovery community organizations, works with people connecting them into sober living, just working on all the different pathways that people who end up in the ER might not necessarily have. Going to the ER that one moment might not have been the thought that they were going to get into recovery. So I work in that aspect, I work literally in my day-to-day life in my career, working with 30 hospitals statewide.
Shit.
And specifically right now, a lot of our research is on opioid prevention and people getting the kind of care that they need, like literally getting naloxone into people's hands that have family members in active addiction that might die. So one of my colleagues recently said, if you didn't do your job, people actually could die. And I think that's important. The second thing I do is I work with a group called Collegiate Recovery at our institution. And we meet on a weekly basis in person with college students who are in recovery.
Oh, wow. That's awesome.
It is awesome because in my college days.
How did you get into that?
We've always had this recovery program in our institution. And early on, I volunteered to help, but I didn't engage in it. But we had a tremendous reduction of personnel. So for one whole year, I was the person that took responsibility to keep it afloat. And then we wrote projects to get funding. And now we have funding for 2 staff to help students. We have campus events. And it's amazing because I do get to see people walk in the rooms of the university room that we're in. And I see people that could have been me at 20 or 21 years old. And I think, what if I'd walked into a room?
Yes.
What if I'd thought at that young age, oh, maybe I could explore recovery and not live in this dark addiction that I'm in?
No, totally. I think you're being really humble. So I'm going to put this out there. I know that you've written some grants and helped get the opioid money to fund these projects personally. I think that is a give back, like the podcast, right? It's your own way of giving back. And I know you don't brag about it, but I didn't know about the groups on campus. And can you imagine if we all would have gotten some shit younger?
What we have heard and we've had on our podcast, the Harmony School, which is, are you familiar with that? Yeah, it's a high school for kids in recovery. And gosh, get them as young as you can, right?
Yeah.
Because you stand more of a chance.
Yeah.
The older you get, the less, like my first sponsor getting sober at 76, when he went to treatment, they told him to his face, the chances of you staying sober are highly unlikely. I think that pissed him off enough to want to stay.
Yeah.
And I know I've seen it. I see it downtown when I go to work. Like I had to start going to work a different way. I was taking Burnside all the way down and then a left to go to work. And luckily, Colette, I said, I cannot go through Burnside every morning. There's people laying on the street.
Yeah, it's heartbreaking.
It is. And I know you can tell these are the same people that are in line in the morning at the rescue mission. And they're the same people at night. Like they have a system.
Yeah.
A survival system. And it's the same people that I see, and you don't see. So I go 12th over to Morrison to go over the Morrison Bridge to not go. Now, on the way home, it's not as bad because the business people are mixed in, where in the morning, you don't see the business people yet. And it almost brings me to tears because there's not a lot of hope for those people. So if I could have gotten some help at Portland State, what are the chances that maybe I don't get involved in the escort service? What are the chances maybe I don't stick a needle in my arm? I think what you're doing, giving them a safe place, and I think that opioid addiction is crazy.
Yeah. I personally have not struggled with
Me either.
opioids, but I
I'm
feel
scared.
like, yeah, it's so scary. And I've seen our students walk in the room and feel home, that they found their home. Just like you said, the in-person meeting, just like I said, extended family. And
Both for me.
when we open that room up and say it's open all the time, and during finals week when it's so stressful, and those were some of the times when you want to escape. You just want to, I want to get my best grade on my final exam and then just get completely drunk.
Wasted.
And they say the week of finals when we have the room open is so important to them because we have Cheetos and potato chips and snacks and Diet Coke and Coca-Cola. We have all these things that
to
are
make them comfortable. Yeah.
And it's all about community. And I think that saying, I'm not going to think of it right now, but the opposite of addiction is community. That's not really it though.
No, I think it is though.
You hear people say that. And I think that's what, for me, my addiction was about digging in and being in this dark, sad place and just being discontentedly content that that's where I went when I was at my most sad, was to get intoxicated and feel so sorry for myself. And that when there's a place you can be around everybody else and they won't let you do that, those are your tribe. Those are the people that you really have to count on and that you can give back to.
Yeah.
So
I have 2 questions. I don't think we've ever talked about Al-Anon on this show. So for our listeners and me, I know what it is, but I don't. Does that make sense? Matter of fact, Janelle just asked me, girl, do you want to go to an Al-Anon meeting? And I was like, okay. But can you tell our listeners what Al-Anon is? That's my first question. My second question is, since you've done all this work at the university with this addiction and making other people feel comfortable, has that opened up your recovery to make you feel comfortable?
So the first question on what is Al-Anon? Al-Anon is a program for friends and family of alcoholics, specifically, although I think it is open to with not just friends and family of people who have addiction. So alcohol and drug addiction.
Right.
And Al-Anon is a program that works the same 12 steps as AA, the same 12 traditions. They're slightly worded differently. And like where there's one step where it says, we admitted we were powerless over alcohol and that our lives have become unmanageable. We're powerless over alcohol. And Al-Anon, it's of the drinks our children take, our husbands, our wives.
Right.
So that it's the same steps, but I will say the thing that having worked both steps, both 12-step programs, Al-Anon's different in its core because instead of being in the middle of it, you're in the adjacent to it role. You are totally codependent on somebody who is an active alcoholic or addict. In Al-Anon, for me, I just kept thinking, if I could get my partner sober and keep him sober, my life will be great. And I was powerless over his drinking. And then I realized years later, I was powerless over my own drinking too. So Al-Anon is a 12-step program for friends and relatives of alcoholics and addicts. that works the 12 steps. And it's really, in my opinion, again, my opinion, much more about our codependency on, instead of thinking of alcohol as their problem, it's addicting to people. And I've shared this with people in the meetings. I could be addicted to just about anything. I think probably my earliest addiction was food. As a young person, I was very addicted to food, and I had a lot of weight gain as an adolescent, but I digress. So the first question was, what is Al-Anon? The second question was with regard to our projects.
So are you open in the university that you're in recovery?
I am open to, not really. I think it's one of the things, and my sponsor asked me about this when I came to this meeting. He said, remember, one of the traditions is we are with respect to press, radio, and film. And my own personal recovery journey is personal, I guess, is what I would say. So when we meet with students, those are recovery meetings, and I do share my experiences as a person in recovery. The language tends to be very different. We use this all recovery language. That's not just alcoholism. It's called all recovery.
Oh.
And one of the components of that is different than when we introduce ourselves in AA. We say, hi, I'm Bill, I'm an alcoholic. And everybody says, hi, Bill. In all recovery, we introduce ourselves I say, hi, my name's Bill, and I'm a person in recovery. And a lot of the language is shifted towards self-affirming and saying, I've become positive statements. I'm in recovery. So that said, I sometimes introduce myself in AA meetings as I'm a person in recovery.
I like that, though. I love that. It sounds like nobody wants to go up and say, hey, I'm Julie. I have a BS and a PhD and a master's and I'm an addict. You know what I'm saying? I have this down. No, I love that. I love the positive affirmation in it. I really love that. And I guess why I've never been to Al-Anon. One, I'm single. And so I would say Cassandra's the first time I've had somebody in my life. I've stayed away. It's safe. I like to do things that are safe.
I know Justin went to Al-Anon.
Wow.
When I started recovery, and he found it very helpful, one, to have someone who could relate to what he was going through with me, and that support. He found that very helpful.
I love that.
Yeah. So we should have him on and he can talk about it.
We should have a couple Al-Anons. I freaking love it.
I also like what you said about I'm Bill and I'm in recovery, because that also, and you mentioned that early on, you were like, I'm not going to say I'm an alcoholic. I'm not. That is something that I went through too. It was like, I'm not going to admit to that. There was just something, it was almost for me in a way, it was, if I do that publicly, if I say that I'm that way, there's no going back.
And does it
and I want to leave that door like a little foot in the door, keep it a little open just in case.
And does it this is my thoughts on it. You and I have discussed this profusely. The first podcast we ever did, I felt naked on a stripping pole because for the first time professionally, I admitted my story, where I kept them pretty separate because I can't be this many people's boss, right? And then you doubt my integrity or anything like that. And I too don't go to work now, even though I'm a little, I would say, out of the closet for the first time at work. But I say I've been in recovery for almost 29 years. I don't say I've been a fucking addict. That does put a stigmatism on it. And I don't think if I was new in recovery, I would want people doubting me, because I've been in recovery a long time. I feel like I can say it safely, but it is a hard thing when you're in a professional atmosphere, I think. And then are people going to be judging or looking at the Christmas party? Right. You know what I'm saying?
Yeah.
I would be worried about me personally.
Also, for me, part of my drinking was to feel a part of, or to be a part of. And admitting that you're an alcoholic or having that, it goes against that. I want to be a part of. Now I've turned it around, and my recovery is my strength. And I'm very proud of where I'm at today in my recovery. And I have no trouble. Obviously, since I did the same thing, I was on the podcast and told my whole story.
We stripped together.
Yeah.
Neither one of us had mixed the professionalism with the recovery.
Yeah. I had a lot of silos. I kept a lot of things separate.
Same.
And I think now that I've taken those silos away and I am who I am, and it is what it is.
It's easier.
Yeah, it's easier. It has more of a positive spin to it. I can be proud that I am where I am.
But I have to tell you, for the first time, I'm not everyone's boss. And I can just be me. And I like that. I'm not responsible for this image. Doesn't have to be portrayed. And I love that. I love that.
One of the things when I travel to the hospitals for my work, and specifically that's on the opioid, fentanyl, heroin, all the issues that we have in our communities, one of the things that's been shocking to me, we were only about 6 months into this project, and I visited 9 of the hospitals, of the 30 hospitals, and you never know what you're going to get into. That's why it's nice to, it's terrible to say. So that is research. Like, I'm literally doing discovery work with regard to recovery discovery.
Yeah.
And one of the things that we found was there were tremendous problems with people overdosing in long-term care facilities. And we actually have maps of where all the EMS calls for all of our 161 counties in the state.
Wow.
And I kept thinking, what's going on here? I thought, I'm going to look at this and it's going to be one of those streets like Burnside that you just described. I thought, this is going to be Burnside. This is going to be this tremendous problem of homelessness. This is going to be all the things that stigma in society projects our drug users. And I look at all these heat maps in my state, and all the heat maps point to long-term care facilities and the elderly and overdose in that population.
Wow.
So that was one of our shocking discoveries, was disproportionate high numbers of overdose that end up in our data are coming from long-term care facilities. And we're actually quickly discovering what happens is there's a medication permission for nurses to give. And if somebody ends a shift and gives somebody pain medication and the next person comes onto their shift and doesn't check the chart, and they give pain medication immediately, they overdose that patient.
Wow.
And so these are problems that was surprising. And just to be direct, the other population that was shocking was people who work in healthcare.
Mm.
So
because they have access.
Nurses, healthcare providers. There's disproportionately high numbers of people with addiction that need supports that are healthcare providers. And when you look at that population, it's just like EMS workers, healthcare providers, first responders. People think, you shouldn't have a problem. You should be the solution. And all of the stress that these professions are on. So those are some of the early discoveries. I'm really thankful. As you said, I hate to talk too much about my research, and I don't want to be sounding like I'm bragging, but I just am so thankful that what we're getting to do is reduce the sense of, people with addiction are the troll living under the bridge.
It's just a small
people with
percentage
addiction
of it.
Could be your nurse or your doctor or your mother or your grandmother. People with addiction are people who are struggling with addiction. It's an equal opportunity employer, I'll tell you.
And the thing about what you said, like the Burnside, you just see that. Okay, that's only like 1% or 2% that you see. There's 11, I forget what, I read the numbers, right? But I took this thing at work, this thing where there's 11 million people that hold down a job that are functional addicts because they need the money to keep going. And it's just like a lot of alcoholics, right? They can drink and drink. It's not till the end that it catches up with them. And because it's so social and it's legal, and I have to tell you, I going through the trigeminal neuralgia, got a lot of medications. And I think only because of AA and hearing so many stories, I was scared. Like, I forget what medicine they gave me, oxycarbendazine or whatever it is. And I wouldn't take it because it started with oxy. They're like, is this medicine working? And I'm like, nope. And it's like this other one, it was samaritriptan, and it sounded like a trip. Okay. And they only give you 9 pills a month. And I was like, this must be really strong if they only give you 9 pills a month. And I was scared to take that because I've seen so many people go out after having surgery and stuff. Luckily, I just heard a million stories. So I was scared.
Yeah.
And because of that, I truly decided when I was off to go through acupuncture and massage and anything but that, and getting off the gabapentin. I felt like I was on a tranquilizer at first. Like I was a cow put out to pasture. It's for real. And I couldn't do it. Luckily, having the awareness, but not everybody does.
Pardon me. Yeah, I think you definitely know this. The first year of my recovery, I had open heart surgery.
I remember you walking every night during the meeting, getting ready for it.
Walking every night. And the second day after surgery, my nurse was in the room and I had been released to a different unit where they had the level of nursing was no longer 1-on-1. It was like 3-to-1 on that unit. And the nurse was in my room all night long. And I looked at him and I said, why are you in my room? Don't you have other patients? He said, yeah, but you're not responding well to the pain medication. Your pulse ox is dropping low. Your oxygen level is something I want to keep an eye on. So somebody took my other 2 patients and I was really scared. And the next day I told my doctor, I said, do you know that the nurse struggled last night for concern for me dying? And could you take me off of the medication you're on and put me on something more mild? Because my body doesn't seem to respond to it. And the doctor did take me off of the medication and put me on 800 milligrams of ibuprofen.
Oh.
And I didn't have any pain after they cracked my chest 3 days before. And I feel like I could be my own advocate for non-addiction in my own life. And I don't think I would have done that before I had worked the program.
Yeah.
But I also know that my sponsor has told me, you also not God. And if you need to be on medication, there's a healthcare provider that might need to put you on medication. So you also need to be aware of that. So that's one of the things I think it's right-sized me to be in recovery, because that's what took me into active alcoholism, was thinking, I know how I can drink until like Monday. Once Monday hits, I got to get back to work. But I need to be able to trust people like my surgeon and the critical care nursing staff that I'm being well taken care of. But I don't know why I shared that story other than to say, I'm responsible for my own recovery, but I'm also have to trust the healthcare providers that they have my best interest. And if I'm questioning that, then I can bring it up with them like I did. And I said, hey, do I need to be on this? The nurse was pretty stressed last night that I was going to die. And my nurse thinks I'm going to die. That's a bad night.
Yes.
It is.
And the doctor said, you're absolutely right. We're going to shift that because you're not doing well on the meds that we have you on.
And not to tell your business.
I was going to say, I went through similar.
That's what I was going to say.
When I got diagnosed with cancer and started that whole process, and I made it, which I probably wouldn't have if I wasn't in recovery, but I made it very clear to them that I'm in recovery. And so whatever I get prescribed I want that kept in mind. And they did. And I did go on some things that I was a little nervous about, like they had me on a fentanyl patch, and with all the fentanyl, I was like, really? But it was to get me through what I was going through, the pain and everything. It was a necessary step, and they monitored very closely. It wasn't like I could just say, yeah, can I get 5 more or whatever? No, they wouldn't.
Well, and I think when you were coming off that medicine, right?
Oh,
you felt so horrible. I could see it in your face.
that was the other part of it. Yeah. I should have worked with my doctor when I was coming off the medication, and I didn't. I was nervous and I stopped it. And so that put me into withdrawals, being hard and heavy. So yeah, you do want to listen to your care, because they like, we got to put you back on. And once they did, and then taper me off over time, it was a much smoother process for me. But yeah, but I was just I didn't want, that's how strong it is with me, that I do not ever want to go back to where I was. It scares me to think about going back to that place, that dark place I was in before heading into recovery. Yeah.
You survived the heart surgery pretty darn well, my man.
I did. I was really thankful that I had the people at the hospital here in Portland where I had my surgery, and I had such good staff, and my family was here to support me. And part of it was the day I got home from the hospital, I asked my brother-in-law, my sister who died the year before from the same surgery. We got home and I put her socks on and I said, I want you to take me for a walk around the block. And I cried, and he goes, are you okay? And I said, I'm taking this walk in honor of her because she couldn't take it.
Oh, I remember. Wow.
And that's also part of like, when I celebrate my recovery, I think of how many people have died from this disease.
Yeah.
That couldn't take that next walk, that couldn't put their socks on and take the walk around the block. They died from it. And that's how seriously I take it. The year that I crossed the line, I think, in all honesty, I was just ready to drink myself to death, and I was okay with it. And I'm so thankful that cop of all people, I went to the chief of police a year and a half later, and I said, I just need to thank, and he was no longer on the force. He's now a state highway patrolman. He's no longer in our town. But the chief of police said, tell me about it. And I said, he arrested me and I hated him for about 6 months. And now he's my hero.
Same.
I was so thankful that he put me in jail, that I didn't get a free pass that night, because it was my wake-up call. That's what it took. And so many people that don't get that moment of clarity to say, can't drink anymore.
I call it my timeout, but I was pissed off too. I'm going to tell you, even the first couple of years of sobriety, right? But in hindsight, and after IOP and whatever, thank God that I got a timeout and I went to prison. And luckily I didn't have to do years and get tattoos and in prison and stuff like that. But no, it gave me a timeout to know I didn't want to be high. And I think it saved my life. And then, to be mad, I saw my pre-sentencing investigation and it said I was not rehabilitatable, right? And I was like, okay.
Wow.
No, I was like, fuck you. Just
don't tell me.
Yeah, don't tell me. And that, and I think I just wanted to come here to get off parole, but staying here has given me a way of life. And I'm so grateful. Yeah. I know you are.
Yeah, we never know. I always like, why me? I had that question a lot with everything that I've been through. But the reasons, if you can call them that, will reveal themselves in time. And I've learned that here I am helping one of my family members, and he's doing really good now. And I was there, and he knows he can call me, and because he knows what I went through. And so maybe that was just the one reason that I went through what I did, so I could help that one person. Maybe it's this podcast and what we're sharing through all our episodes and stories that we've shared.
And maybe it shows you're stronger what we go through.
Yeah.
We're stronger than we think. And I think that had you got cancer beforehand,
Oh, yeah, that I
would
wouldn't
you?
have
Yeah.
been equipped like I was because I relied on so many of the same tools that I used in recovery to get me through the cancer.
Probably the same for you, Bill.
Yeah, it
with
is.
the surgery.
The one thing my Al-Anon sponsor has always said to me, there's a reason where, and I say this in a lot of meetings, it's, how people have a thing they say all the time, this is my thing. It's my sponsor from Al-Anon's thing. She says, there's a reason why the rear view mirror is tiny and the windshield is in front of you and is enormous.
That's awesome.
The rear view mirror is there so you can always look back and know where you've been, but don't spend too much time staring at it. Keep your eye on the windshield.
Yeah.
And I always feel
that.
it's just so important for me. Like when we talk about our recovery journey, like how bad did it have to get? Every one of us has a rear view mirror. Like glance up and look there so you can remember that's not where I want to go again.
Yes.
And when people have this story that I also have, that I went out and that I had to do more research, then and I know that there's this sense of shame when you come back because I had it. And then I think, no, if there's a point where I can get into the driver's seat of my own life and keep the rear view mirror in the past, keep that stuff behind me and look forward to whatever my future is, the future's bright. And there's so many things that people say in the meeting, that's my thing, but then there's no problem too great that a drink won't make it worse.
I agree with you.
Yeah.
Your worst day,
it's true,
sober is better than your best day using, if you really think about it, because I just can't even compare. There's no comparison. And I know we all think part of it was fun at some point, but was it real?
Yeah.
Yeah.
It started off pretty good, and I was status quo with everybody around me through high school and college. But then everybody around me grew up and I didn't, the way I look at it. So Peter's still out there doing his thing. So, yeah.
Was so innocent until I started using, and it went from 0 to 10 so quickly. And I'm glad it ended quicker. You know what I'm saying? Yeah.
And for me, it just took a huge collection of horribly bad events in 1 year to swiftly make me cross the line. I would go buy those 12 packs of wine, and I would drink a bottle of wine at a time. And I thought, this is just going to be the new normal. And it was only 3 months, like from the initiation of my excessive drinking to being in jail was 3 months.
Wow.
And at that point, I realized you lost your drinking privileges.
Yeah.
You can't drink anymore. And that's the other thing my sponsor says. I hate to say all these things, but like once you're a pickle, you can't be a cucumber.
I love that.
I love that one.
I love that
and
one
it's
too.
like, oh yeah, you're right. But
And you know what's cool about your sponsor, right? And you say putting the number in the chat. That person doesn't sponsor 1 million people. That was like a one-off. It's crazy. What good fortune. Just crazy.
And there's another random thing I'll share about my sponsor. So I started my sobriety date as August 13, 2022. And my birthday, belly button, is November 16th. And we were scheduled, it was a Saturday, and I was 3 months in the program, and I was probably on step 2 or 3. And I still said, I really don't think I'm an alcoholic, but I'll do this exercise with you. And so he said to me, I said to him on my belly button birthday, November, I said, could we shift our date this week? Because it's my birthday this Saturday. He goes, that's so weird. Saturday is my birthday too.
Wow.
I go, your birthday? He says, yeah, my birthday, November 16th. And I go, how weird. I go, what was the year of your birth? And he told me the year. And I go, oh, that was my second year in grad school. And I got drunk with my boyfriend at a gay bar, and he was making out with other people, and I got really depressed. And on the way home, I tried to jump out of the car, but my seatbelt was on, and then I couldn't get out of the car. And then I don't really remember how I got in the house. And he says, "You never have to question that you're an alcoholic again." And I go, "Really?" He goes, "Really?" He goes, "Normal people don't do that. That's alcoholic drinking, and you've had a lifetime of it. Why didn't you just have the rest of your life in a better place?" And again, it's like these kind of God shot moments where I'm like, what are the odds that the person that I randomly picked that raised their hand randomly in that night is my sponsor was born 30 years to the day after I was born? And
That's cool.
it's just like a God shot. And when you stay long enough in the rooms, you hear people tell these stories and you think, is that just
Kind of
coincidence?
wonky, but then it happens to you.
Whatever it is, I'm going to just call it a God shot.
There you go.
And so I just am so thankful that my work gets to intersect, my service to the students I work with, the community, my extended family. It's
You're
been a
building
miracle.
a good life for yourself, Bill.
It's a pretty sweet life.
We just want to ask you, we ask everyone.
I think he's said several already.
I was gonna say me too. I think so too, but are there any last words you have for our listeners?
I just feel like find your tribe.
Yeah.
I don't know that anybody said that, but I've said that a few times here. And for the longest time, I would try an AA meeting and it wasn't my space. But when I found the extended family and lunch bunch, I just felt like they are my extended family in the darkest of days to come in the future. I will have sad things, which I told you, like one of the biggest things I fear is a death of my brother. Like I fear, what if my brother died? He is my closest friend in this world. And you said to me, you'll stay sober if your brother dies.
You will.
And I don't need to be so spun up, but so the one thing I would say is find your tribe. It's extended family is it for me. And if it's not it for you, I also have a 11-step meditation group that meets every Saturday morning, and they're based in Portland as well.
I've been to that meeting a few times.
I love that group. I religiously attend it for the last 18 months.
Wow.
And it is focused
meeting.
on the 11th step. And I love that group too. And for the future, I hope that I can maybe find an in-person meeting in my hometown. Maybe I'll start a meeting. I feel like there's no place for gay, lesbian, trans people to feel comfortable at meetings where I live. And maybe I'm going to try to open the door for people as far as recovery when you're already feeling marginalized.
There's not a lot of places, believe it or not. So Portland is blessed. But when we went to the North Coast Roundup in Seaside, there was a lot of the LGBT community that went to this conference because there was nowhere they felt in their little rural towns comfortable.
Yeah.
And we're lucky. We're lucky that Portland, and I have to tell you, we're one of just a few meetings that are listed for the trans population. Thank God.
Yeah.
I want to thank you for being
Well,
here.
thank you.
Yeah, thank you so much. It's been a pleasure, absolute pleasure.
It is. I really appreciate people coming on the show and giving their time. It really means a lot to me. And it always makes me, even though I know the person, feel so much more closer to them afterwards.
Yeah.
It's like just sharing your stuff is important and it'll help somebody. Maybe somebody in some university will start something and make a space like you.
Is that just real quick? I was curious. So the research that you're doing, what is the fruition of that, or what's the end goal? Is it to spread those types of meetings or rooms across the country or in other colleges? Or
So the research that I'm actually doing will end in a summit where all the hospital staff from our whole state can come together and learn from the lessons of what people are doing at other hospitals that they can duplicate in their area.
Okay.
With one of the things specifically is there's a problem with discharge from hospitals for people to get into sober living or to get transitional housing or to get linked to community care services.
Okay.
So when we have our summit, which will be a year and a half from now, that will be after we've collected all the resources that all the hospitals and all the state use. And then those resources will go into the summit. And then we're going to extend it to non-rural hospitals. So our current study is only on rural hospitals.
Okay.
So then the next step for the future will be to extend it to the metropolitan and larger city communities like Portland.
Yeah, Portland needs it. We need any help anyone can give us. Just really second in addiction in the United States. Mhm.
Very cool. Thanks again.
Thanks for asking about that. I'm honored that I get to do the work that I do that intersects with my recovery life, because not everybody gets to, what do they say? Do what you love and you never work a day in your life. So I don't feel like I have to work. I just love what I do every day of my life.
I love that.
This podcast is that for me, although it's not a well-paying job. It doesn't pay anything. But I'm also through this podcast, I've made contact and association with a lot of great, wonderful people. And one of the clinics, Another Chance, is doing a program with the Washington State University on using transmagnetic cranial stimulation to help with addiction. And so I can't tell you much about it because I've just got hooked up with it, but that'll be my future. I'll be able to work in that. And again, it's like doing what you can.
Yep.
It's not going to be work. It'll just be, how giving back. It'll be another give back. Yeah.
Just take the next step. That's what I say.
Yeah. What's crazy is I've never thought a person was more perfect for a job. Like, seriously, I saw this job on LinkedIn and I'm like, oh my God, what are the chances? And we had done a couple stories on Another Chance, right? And
yeah, it's like we said, the God shot moments. It's like, I've been to the clinic. I'm familiar with the clinic. I know the CEO, the owner,
executive director.
Yeah. And so all of these things click. And then after meeting the doctor who's heading up the whole program, we clicked like that. Life is just crazy that way.
Yep.
Amazing. What a comeback, huh?
Yeah.
For Peter in 1 year. Thank you. This is Julie.
And this is Peter.
And this is Bill. Thank you.
Thank you so much. And thanks everybody for listening. That's a wrap on today's episode. Thanks to each and every one of you for lending us your ears and hearts. Your engagement is what fuels our passion and keeps this podcast thriving.
We cherish the moments we share here and hope they resonate with you, whether you're on a daily commute, at the gym, or just taking a moment for yourself.
Make sure to head over to our website at realrecoverypodcast.com. While you're there, subscribe to our newsletter for the latest insights and uplifting stories from our community delivered straight to your inbox.
Click that subscribe button on your favorite podcast player too, so you can keep up with every new episode. It's your support that keeps our conversation alive and meaningful.
And if our stories have touched you, consider using the donate button on our site. Your contributions, no matter the size, are deeply appreciated. They help us continue our mission of sharing hope and healing.
Join us beyond the podcast and follow our journey on social media. Find us on Instagram, Facebook, and on X, formerly known as Twitter. All the links are on our site, so you can stay connected and be a part of the Real Recovery community every day.
Your likes, shares, and comments not only spread the message of recovery, but also remind us that we're all in this together.
So, until we meet again, remember that recovery is a journey, not a destination, and we'll be here to accompany you every step of the way to recovery, real recovery.
Thanks for listening.